And that's for, last time I checked online, it's like $500 something. So medical practitioners might just say, let's try this, let's try that. So it's easily jump into defensive medicine, and it could be very stressful. And the worst thing is that among the medical teams, some medical workers get infected and even died. That's very that's quite some issues. So now the practice is very challenging. They see the life and death situations and cry with them, and see the life and death situation among their peers. So that puts a huge stress on practitioners' mental health, physical health, and family relationship. You see the reports that some people wouldn't dare to go back to see their family for days, months. And so this paper will be about how medical workers, especially the young ones fresh out of medical school, should handle these issues, especially like in Boston University. They graduated their medical students earlier, just let them practice to jump into the team because they're short of the young practitioners. Those doctors or nurses are very mentally demanding jobs. They did a research in a OBGYN in a hospital, and showing so many doctors and nurses, they are actually highly burned out, especially in OBGYN. And for before COVID, it was like that, but after COVID, it's even worse. Doctors would feel the concern, anxiety, uncertainty, and stress. And they stay out of their families just to avoid their families getting infected. And protection gears are not enough. Those doctors, they do have expectations for those senior doctors and young doctors. For seniors, they're the ones who are easily get infected, so they're supposed to come in and make the decisions and go right away. And for those young doctors, it's not your role to make decisions. No. And you don't want to be the person to pull out anybody's ventilation. Work in a team, because you're not experienced enough, and you don't have you might not have the enough knowledge yet. So go with a team. So introduction, like a UK doctor, they do their medical practice under their extreme stress. During their practice, many of their friends and family died from COVID, and they don't dare to see their family for a long time. So those are other common problems for the doctors. And as a doctor, they might get exposed to COVID, because they're taking care of the COVID patients. And COVID can cause long-term health problems. Some patients complain extreme tiredness and shortness of breath for several months after the infection. it's reasonable because COVID not only just caused infection, after the infection, the lung structure got damaged, and for a long time, they might not recover, and they might not recover the rest of their lives. And it's a multidisciplinary approach, like kidney failure, like heart failure. That means those medical practitioners in a hospital, no matter what they're dealing with, no matter what aspect they're working at, they will have to deal with COVID patient, no matter where they're working in doctor. And to make it worse, and one of the US-based doctors named Stella, saying that she was facing death threat because she claimed that she found a cure for COVID. She said she treated her patients with hydroxychloroquine, zinc, and Zytromax, and none of them died. And then someone gave her death threat. And in America, these doctors can publish an article or something to have a voice, but in other countries, it's not the case. Like in China, just because those doctors and nurses complained about their equipment, the proper protection gears, and they got suicided. And like in Russia, similar things happened. Also, some medical doctors probably have to swallow their tears to pull out patients' ventilation machine. So with all those problems in mind, how medical workers should protect themselves is a big issue. So the method of this research is literature review, because currently there are not a lot of systematic literatures coming up yet. So this review a lot of them will be based on news, result, and discussion. First thing first, let's be aware. Did you see Donald Trump's any children working as a doctor? Or did you see Joe Biden's son or daughter working as a medical doctor? No, they're lawyers. They're quarantining. They're working from home right now for themselves. People who work in the front line to make a living, not because they are billionaires' kids, but because they probably need this money and they need this job. Otherwise, they wouldn't have to work in the front line right now. On the other hand, let's check the employment for those medical workers. The sad part is that as much as medical workers are in need right now, the organizations are laying them off. For instance, blah, blah, blah. In conclusion, the year 2020, they experienced 43,000 laying off of medical workers, as seen in the graph. Now let's look at this graph. Look at the year 2003 to 2004. That is when SARS are in progress. Okay. 2003 13 or 14, I think it is even swine flu or bird flu. 2020, they're laying off so many medical workers. To sum up, currently they want you to work at the front line, but with economy so bad, nobody wants to pay you. Nobody can afford to pay you. And some small clinics are afraid that they will not survive the pandemic. And currently, a lot of their visits turn into televisits. The insurance companies probably wouldn't want to reimburse them for televisits or reimburse very little. So after the long pandemic, whether these small clinics will stay open is still a question. So as a frontline worker, actually you see some frontline workers, they either died or permanently disabled, and the rest of them, well, they will be lucky if they just work through the front line and then survive and keep working. But actually, you don't want to do that. As a frontline medical worker, it's so important to get the right bargain. You're one of the very few who stayed at the front line, use your life to protect and treat those COVID patients. Make sure to get the money you deserve. You're risking your life to do the job, but when the pandemic is over, when you survive, that crowd of medical workers will come back to the job market. And hard to say you will still have a job by then. So now, earn every penny and you deserve and save it to invest in yourself later on. You will need that money for a great vacation. And right now, it's really not the time for you to spend. Those stores are not having great sales. Those restaurants are not selling the best food, and you cannot go out to eat. You cannot go to have fun, and those cinemas are not great place to spend your money. So now when you get your bargain, save it. And we'll talk about it later, how you save it and eat right and eat healthy and to get through this ordeal. And now right here, using mindfulness to overcome the stress. I know you have long shifts. I know your job is not easy work. So every day is so important for you to journal and taking your break. Each time you are taking your break at your work, bring the good food and chew your food. Use your mindfulness technique. Love your food. Focus on your eating and eat the right portions. And it is your body that takes you everywhere and move you around at work. Make sure keep it healthy. And this is not the time to binge eating, enjoy those steaks and pork tenderloins. Be careful. Obesity is a risk factor for COVID. You don't want to binge yourself right now. Now plan a vacation after the COVID. One of the best ways to deal with stress is a nice vacation. People under stress are prone to heart disease, while vacations ease stress. It can reduce mortality from heart diseases. Also, after the pandemic, as a frontline worker, you're so exhausted. Take a long vacation. Carefully spend the money, the bargain you got from your work during the pandemic. And this time, during the pandemic, many medical workers got laid off. After this, they're gonna come back. It is time for you to take a detailed, planned vacation. And you never know how you can plan your vacation. The Beverly Hills doctors, they design vacation include plastic surgery, shows, amusement parks, museums, or in Hawaii, vacation with eating poke and best tropical fruits. That's the time that you can indulge. Plan your own. I was only offered some ideas. And another thing is about suicide prevention. These life and death situations you see every day, those are traumas. So as frustrating as this medical job is, saving lives are always important, not just for the patients, but for yourselves. Speaking about the stress in the medical works, physicians are very prone to suicide. You check the documents, their physician suicide rate is way higher than general population, and they're trained to have power to endure long hours, difficult and stressful situations. No, don't believe that. They're human and they're trained to endure the deprivation and basic needs. No, don't believe that. They are human. They're really bad for their physical and mental health. So medical school didn't teach you to maintain your personal health, but do that. Prepare yourself. It's your body. Love it. And here, one of the most important methods in suicide prevention and trauma healing is saving lives. In a person's life, there can be many traumas. Each trauma increases the risk of suicide. So suicide does not discriminate. All the people enduring enough stress will happen to that person. You think you earn a lot of money. You think you are a great physician. You think you are healthy. You think you are prone to those things. No. Just by all means, just get yourself out of those traumatic loss situation. Just don't go seek counselings, go seek help, and improve your own wellness. Make sure yourself is not a sufferer for those traumatic loss. And after a traumatic loss, for those medical doctors, there are a lot of traumatic loss currently, seeing their peers died and seeing the patients died. You think you don't feel it. You're seeing another human being leaving this world. Oh yeah, even if you're numbed, you can feel it. Your heart is feeling it. So for those professionals on Frontline, after this pandemic, they probably need a long time to recover. They need long-term professional therapy for that. They witness traumatic loss every day. Although a caregiver sees these things a lot, these usual traumatic events will still hurt them and make them cry. And all those events become traumatic events for the caregivers. Therefore, they probably increase the future suicide rate. So the important thing is you think of something to save a life here. So think of something. If you don't have the money, that means death. If you don't have the protection gears, it means death. But it wouldn't kill you to brainstorm, to think of something. So as those lung doctors all know that for those lung doctors, they need to clear the airway to make sure the lungs functioning, especially for those lung doctors, respiratory doctors who don't have much gears. They really know just smack that patient's chest and give them put them on the edge of the bed and smack their chest and let them cough and let them cough out everything. That way, that is the easiest way to empty the lung. Don't be too cautious at this situation. Saving a life is to saving your own life. It's not superstitious. It's medical science. So, conclusion. When new caregivers on the front line during COVID, knowledge about patient care is not enough. They have the most important patients to take care of themselves. Protection gears are very important. Don't get nervous. Just don't get too nervous. Don't practice defensive medicine. And life is not fair. So get the right deal for yourself. Take care of your own health and saving lives, and prepare for your vacation, and make sure empty the airways by all means. Don't practice defensive medicine. Let's put a tube in, even if you can cough, even if there's a clean restroom for you to cough things out. No, just go ahead and clean the airway by all means. This is the preventing the defensive medicine, and now we're talking about escaping the cytokine storm for the poor. So for poor people, the low income and people in a property have high COVID infection and mortality rate, you have to find a self-help solution. So this is following through a case for 5 months for the self-help. Let's talk about the self-help. As a poor person, you wouldn't have enough medication or help for yourself. So herbs can be helpful. One of the herbs I recommend here is Radix gudularia. It's antiviral, anti-tumor, antibacterial, and anti-inflammatory, and hepatoprotective. It's kind of little pieces of tree branches. You can find it in Chinatown for like 10-15 bucks per pound. That thing, you only need little pieces to do the tea, to do the anti-inflammation. And comment on current medicinal usage. Currently, there's no market sold herb medicines that looks useful. And there's a Chinese herb called 莲花清瘟 that is a quack. That if you're interested, you can look at my paper. And cooking garlic, go wild in using garlic. That is very good antiviral. And cooking ginger, and go wild with ginger to drink tea with that. And rice soup, while garlic, ginger, and orange peel are antivirus, the rice soup are for, is a natural and natural diuretic, and makes you pee. So cook those things with your rice. It will eliminate toxin by getting rid of extra body water. And here we'll talk about brown rice and white rice. Brown rice is more nutritious, more a diuretic than white rice. And here I have to say something else about what affect COVID recovery. Circadian rhythm. Make sure have a good sleep. If your boss tells you, I'll pay you more if you do a night shift, after this day shift, another 10 hours, say no. They can always get somebody else, because there are some people want to earn this money during this COVID time. This is not the time for your employer to save their money. Find someone else. And a balanced diet. Eat well, eat right, and don't stay hungry. And wear mask. That's very important. And hand washing. So I saw so many videos on YouTube that they were not doing the right hand washing. I did put on my own hand washing, and the WHO did have a really good hand washing video. Hand wash right, and especially after you wash your hand, don't use your dirty hand to touch the don't use your clean hand to touch the dirty faucet, because you can always use a piece of paper towel to turn off the faucet. Okay, hand washing, must wash 20 seconds with soap. Must discern what is clean and what is dirty, and separate these two parts. And conclusion, clearing the airway, just cough and let them cough out, and self-medicating with garlic, ginger, orange peel, and rice soup, balanced diet, wearing mask, and hand washing. This is all my presentation. Any questions? Hello, can you hear me?